Good afternoon, everybody. Welcome to AHI Health Home Office Hours for June. This is Travis Bethel, and glad that you could join us today. So we have this recording as usual, so that it'll be available for folks on the website in the near future. If anybody has anything they want to talk about along the way, feel free to unmute or send something through the chat. Alrighty, so we'll get started. So we're going to touch quickly on policy and procedure today. Children's HCBS Year 3 audit, what's going on with that. Health Home Annual Chart audits, touch a little more information on that process. Quality Management Program Committee, some more information around the Quality Notebook, core FAQs, and United Healthcare discussion. So we have 8 policies that we've sent out in the last couple of weeks to the network, and we got talking about would that be prudent to go through each one in depth during our normally scheduled office hours, given the number of policies. And it was decided that we would do a special office hours so that we could give just service to it and take the time and walk through each policy individually. So we're going to do that on July 18th, which is a Monday, from 2 to 3:30 timeframe. We may not need that long, but we're going to block that in the event that there's discussion that takes it into further time. So I'll be sending out an office hours invite for that special office hours. That will be recorded also. I know some folks are getting ready to take vacation or will be on vacation at that time or some other time off. So we'll have that recorded and put on the website for folks to access. But those will be encompassing the comprehensive assessment, informed consent, disenrollment, health home qualifying conditions, referrals and assignments, HCBS rights and choice, palliative care, bereavement services, and the health home supervisor and caseload ratio policies. So those will all be reviewed on the 18th. In the interim, if there's questions, feel free to send them our way through the health home email or reach out. We also have our policies up to date on the health home policy and procedure page as well. We will have this out in the near future. Likely this afternoon, I'll send out that invite for that July 18th date. Children's updates. So currently there's a compiling of requested materials that DOH has requested for Year 3 audit, and that audit is scheduled to start in the very near future. So we're looking to get that stuff into the state. I know Jessica, who's actually off right now, has been spending a lot of time compiling that information to get that in. Another piece as well as the HCBS qualifications and training spreadsheet that's gone out to all the children's teams. That is something that has to get back as well to Jessica. And if you could do that in the fashion that's requested, that would be much appreciated, because that's got to get in as well. So we're looking at July 11th for that to get back to her if you could. Anything so far on anything we've touched on that anybody wanted to ask or have any comment on that they want to talk about? No? Okay. So more to come there. So as this audit starts to progress, we'll definitely be sharing information with everyone. Thank you for all those that have been getting that information back and getting that to Jessica, because it's just helping her expedite things that much quicker. Lauren. Which Lauren? Lauren, where are you from? Lauren who? I just see Lauren. I'm looking at the chat. I'm sorry, Lauren. With Lauren, if you could just send us a note of HCR. Okay, thank you, Lauren. Yep, we can definitely add you to the invite list. Alrighty, so anything else around the things we've talked about so far? You're welcome, Lauren. All right, quality notebook. So I wanted to talk about this again. I know it's been on the docket the last few months, but I just want to continue to stress the importance that we're trying to have this as a quality tool to enhance our quality management program as part of our follow through from our DOH audit, but also we want it to be a proactive tool for folks once people get up and snuff in some of the areas that they're working on. We are asking organizations to follow up. In the event that agencies aren't, we're going to be following up further. So I just want to stress that again. And I don't want anybody to be surprised if there's a decision not to follow up to our request, that we follow up further and potentially could move to further than just a regular plan of corrective action. It could move toward potentially a performance improvement plan for an organization, depending on what the circumstances are and what the requirements are that aren't being met. Because we want to make sure that we're meeting billing requirements, and that quality and policy and procedure are being followed that are set by Department of Health. We want to partner with you all to do that. And most everyone has been really great about that. But, as always, there are certain circumstances where, there is not follow up. And we're really asking that folks do that. And if you're running into issues with any of the quality notebook or questions, please ask us. We want to partner and we want to help walk through that with you and resolve any concerns. So just wanted to share that again. If anybody wanted to mention anything, any commentary around the notebook itself, please feel free to say something now or reach out. We'd be more than happy to talk about it, receive any constructive feedback, etc. But we're really looking at this to be a two-way street. We're putting a lot of time into this document for everyone, but we're also asking that folks reciprocate and follow through on the things that are being requested. Thank you, Michelle. We're hopeful that it's very useful for everyone. So I don't want to belabor this, but I just wanted to put that out there for folks, that it is something that we are taking very serious as we're moving forward and follow up and presenting to the group. So thank you for your time with it and the follow up that those folks that have been providing information. We appreciate it. Then we also have next, we have an audit that we're doing every month. We're pulling a sample from certain organizations. It's something that the Health Home's done over the years. So this year's no exception. We did go virtual to it a couple years back because of COVID. We're trying to reinstate in person as we're able to with certain organizations, as long as people are comfortable doing that. So it may be a mixed bag of virtual versus in-person meetings, but we're getting ready to start our road trip, if you will, of meeting with organizations starting in August. So those organizations that have had their charts audited up to this point this year, there'll be meetings. Taylor will be reaching out to schedule those meetings with each of those organizations. And it's not just going over the audit results. We're going to keep the same format as we used to. When Jessica was primarily doing the reviews, we're going to be having it as an open discussion and opportunity for Q&A, just general discussion that the organization may want to have with us. So we want it to be, again, a comfortable discussion and a good discussion. But we just want to let you know that it's coming. So August, expect you'll see those invites coming out in the near future, and we'll be looking forward to meeting with all of you as the rest of the year goes through. Another thing around quality, we're looking to start a quality management program, a committee, if you will, a performance committee. It's something that the Health Home was dabbling with a handful of years ago, but it never really got off the ground. But we feel it's very important that we get such a committee going as part of our quality management program. So it's really going to be looking at different stakeholders throughout the North Country region from various organizations, not necessarily just CMA representation, but we will have some of that as well. And we're going to be looking at, quality initiatives that the Health Home is going to be looking at in general, also looking at gaps in care, various quality measures that we're charged to as a Health Home. Each Health Home has gaps in care quality performance measures that they're held to, that DOH monitors. And so we'll be looking at that stuff and starting to talk about how we can enhance that and improve it for AHI Health Home and all of our downstream providers in our network. So we're looking to have this committee in place by the end of the third quarter of this year. So we will be starting to pull that together in the next couple months so that we can get our first meeting on the books. I'd like to have that by the end of the first quarter if possible. And, so I just wanted to make sure people are aware that this is something that we're going to be putting in place that has not been. I'm looking forward to it in particular so that we can get some feedback outside of the health home itself and have other players involved as we're looking at quality initiatives across the network. And I just wanted to put up here again our performance measures on the adult side of the program, and the next slide will be the children's side that we're held to as a health home, for the North Country region, very similar to across the state for other health homes. And the areas that you see highlighted here are areas that we need to work on. So, our follow up after emergency department visits, 7-day, 30-day, around mental illness or alcohol or other drug dependency. We really got to work on improvement in those areas. Our chlamydia screening is an area that we got to look at. So those are things that we'll be talking about through this committee and partnering with, like the Adirondack ACO and getting some of those players on board as well, because there's a lot of similarity with the clientele that we're working with that cross paths between our providers throughout the community for medical care, and also those that are health home recipients. A lot of those patients cross paths throughout the North Country. On children's program, we scored 100% on our measures there, which was, as we talked about, very exciting because we're the first health home in the state to do that. But again, we want to keep working on improving and pushing to make it even better for those children that we're working with. So, that'll be something that we'll be talking about as well through this committee. So just didn't know if there's any thoughts, any comments around the performance improvement committee concept that will be coming forward and becoming reality in the near future. All right. Well, if not, if you have any questions or anything you wanted to talk about around that, please reach out. Be more than happy to talk about it as we're pulling this together. And we look forward to, once that committee is up and going, to bringing that feedback to this group as well, when we have that first kickoff meeting, especially. So it's going to be exciting for us. Next thing is the frequently asked questions for core providers, provisionally and fully designated, was updated, the FAQ. I just wanted people to be aware of this. So I put the links in here. It was just updated as of late last week. And here's where you can get that information. So that's for folks to have. And then before I get into this last topic, I just didn't know if there's anything anybody had for questions thus far, anything you want to talk about. Okay. It's going to be a quick office hours this time. United Healthcare. So we were meeting with them recently, and they were asking a question in general about hospitals. They're getting feedback from various health homes and agencies across their network that there's members being discharged without a 7-day follow-up appointment put in place. And the reason they're being told is due to backlog. So we didn't know if anyone's come across that in their paths working with anybody that's been affiliated with United Healthcare that's been into the hospital and been discharged and not had those follow-ups. You don't necessarily have to answer that now, but if you do have any feedback on that, or anyone who's been impacted, if you wanted to let us know so we could provide that feedback to United Healthcare, they would appreciate that, because they're trying to look into this and have some substance to take back and do follow-up with those hospitals individually if necessary. So not having those direct answers at the moment, I said I would bring it to our larger group to hear, and if there's any feedback, that we get that together and get it back to them before the end of July. So if folks have that, if you wouldn't mind sharing, please let us know. And that's all I had this time, because we wanted to spend so much time on policy next time. It's a little bit shorter, and we got folks taking time off and whatnot. So we don't have the full house here this office hours. I'll give another quick update. So St. Joseph's Rehabilitation Center and People USA are both in the midst of their MMISD applications. They've been submitted. So we're just waiting on that timeline for them to get the green light. And then we will be scheduling our onboarding training with them. So we're excited about that. We introduced Weight House last month. We're excited that they're on board, and they're starting to take referrals at this point as well. So that's exciting. So they're getting up and running. And Lakeside House up in Saranac Lake also is getting themselves ramped up and getting into more and more referrals now. So we're starting to add more resource out there for organizations. And we're excited about that coming into the mix for our network. So that's the updates on that front. And that's all I had for today, unless anybody had anything. Oh, that's great. Yes, Tanya, we're excited too for you guys. We're glad that you guys are getting up and running here. Sarah just got a question. Is there a place to find out what agencies provide what services in what counties? So we have on our website our provider link. We have the counties that each agency has, and we have to get Weight House on there. They're the next one to get updated and put on. And then what types of services. So we're actually in the midst of updating that as well, but you can get that right now on the website. So if you go to our partner organizations link through the HIA Health homepage, you'll be able to see the list, which counties they work in, and then the different types of specialties, quote unquote, that those organizations work with. I know Taylor had sent out in the last month and a half a request just to get those updated from folks. So we're in the process of working with our third-party vendor who maintains our website page to get that updated for everybody. So if you haven't had a chance to get that back to Taylor, or if you'd like to send us an update, if you look at that page and you see that it's not what you think it should be as your organization representing in the health home, please let us know. And we can make a point to do that for folks. We're actually in process of updating the overall health home webpage itself. We're looking at some brochure updates, and we're starting to do some community engagement marketing for health home as a whole. So that's something we haven't necessarily done as much in the past, but we're looking at that as we move forward in the future, just to better educate folks out in our communities. There'll be some community engagement events that some of our health home team will be attending throughout the area, and we're hopeful that that's going to not only educate but possibly bring more referrals for folks who definitely need services, and that would be children and adults. So you'll see and hear more of that, and we're also looking at trying to enhance some social media presence around the health home in general. So we're talking to our communications team at AHI and working with the social media piece to start looking at that. So folks who have any connection to our AHI social media platforms may start to see some of that stuff popping up in the near future. So we're looking forward to getting that moving a little bit. Any other questions? Anything else that anybody had that they wanted to bring up? All right. Well, if not, thank you again for all your time. Enjoy the nice weather. I think we've got a decent run here for a few days. Have a great 4th of July weekend for those that are going to be celebrating. And thank you for all you do. And we'll be in touch. Have a good one, everybody.
Travis.